Hi guys, I just thought I'd do a quick video today. Hopefully it won't be too long. It's just to give you an update on my cardiology appointment which happened this morning. I've only really been back home for about an hour. The appointment was 9 o'clock and these things take forever. You sat around for ages and I was passed from department. I had to have like an ECG and it was just a bit of an epic. But anyway, I've seen two guys today. It was the cardiologist and the obstetrician from the antenatal unit. So it was a maternity cardio combined clinic, which they do once a month. He did another ECG, I think just to double check. He had an ECG copy from when I was at the hospital as well. So he took a family history and just asked me the various questions about my heart rate in the past. Now my heart rate's always been quite fast. Even before I was pregnant, it was like in the 80s, 90s, which is quite fast. And I have had that checked before, and I was diagnosed with an ectopic heartbeat, but I've never been diagnosed with tachycardia. So he just sort of like, I was like, okay, that's fine. You've not had any diagnosis for anything. I was like, no, nothing before pregnancy. So he basically just explained, what he was going to discuss with me. And he said that, he asked me about palpitations, which I have had. They're not daily by any means. I'd say a few times a week perhaps. I noticed that I've got like a fluttering sensation in my chest. It doesn't bother me. I'm aware of it happening. I don't go peculiar when it does happen. It just feels a little bit odd. Feels like it's just putting an extra beat in, basically. Excuse me. That wasn't a concern. He asked me if I had any other symptoms, and I said, well, obviously I do know when my heart is racing. I can tell. I feel like short of breath, but it's not. I can just tell that my heart's really fast. So when I double check it, on those occasions it's pushing sort of the 130s, and all I'm doing is sitting down. I said, I can't say it happens like really, really frequently in the day. I'd say maybe 2 or 3 times a day I'm noticing that it's racing. Sometimes it can just be 120, sometimes it has been in the 140s, but not all the time, and certainly not regularly in the 140s. But if I just go for a little walk up the road with my husband, for example, it can hit 130 easily, and all I've done is just literally 5 minutes walking. So because of that, he said that he'd prefer me to be on a beta blocker. Unfortunately, I was really hoping to avoid any more tablets because this has been quite a highly medicated pregnancy as it stands. I've been on cyclizine, on dansetron, ranitidine, various different constipation relief tablets. I was just really hoping that this little boy didn't have to deal with anything else. But they're the experts at the end of the day. You've just got to go with the flow. So he's put me on 1.25 milligrams of a tablet called bisoprolol. I have heard of this tablet before. I work in sort of like the medical environment, clinical environment, so I have heard of these tablets a lot, but I thought I really didn't want to take them, and I did say to him I wanted to avoid it. He says, I know, he said it's not ideal, he said, and we don't really like giving this tablet out to pregnant women. He said it's fine, it's not super risky at this stage because I'm 35 weeks, I'm not so far off full term. He said that he's not too concerned, and he said it's a very, very small dose, so it's literally just to drop my heart rate a little bit more, because he was more concerned about labour than anything else. He said the stress that labour will put on you and your heart, he said it's worth just taking a little bit just to drop it down a touch. He said, I'm not concerned about your heart, really. It must be coping okay because the structure is fine from your last scans. I've had CT scan and I've had numerous ECGs, and I've had ultrasounds done as well, and everything's come back fine. So he says he's not concerned about the structure, he just doesn't want my heart to have to work even harder if we can help it. So yeah, I'm on that now until I deliver, and then I will be seeing him again postpartum, because he wants to double check that my heart rate comes down and that everything is going back to normal, and he just wants to see what my heart rate is normal, because he did say that 80s, 90s is fairly high, which I knew anyway. So yeah, he just wants to monitor that, and because he's put me on this bisoprolol, he wants me the obstetrician who was from the antenatal clinic said, I would like you to have a growth scan done in 2 weeks' time, just to double check everything. He said, because bisoprolol basically, it slows your heart rate, but it can slow babies, and it also can limit the blood flow to the placenta as well, reduce that a little bit. So he said, I just want to double check that his growth is still continuing as it should be. He said, I'm not concerned because you're so far along. He said, we don't really like giving the tablet out to ladies who are early on in pregnancy, but at the end of the day, if you need the tablet, you need the tablet, and it's was one of those things. So I've only just had it. I have read some of the side effects, probably shouldn't bother, but I have. Nausea can be one of them. I was like, oh God, no, please, no. If it makes me feel worse in that way, I'm going to have to go back and say something. I'm not putting up with more nausea. No way. So I will have to have words if that comes back. Constipation was another. I think that's a side effect of everything, but so is diarrhoea. I think they just put those three on to cover their backs, to be honest. So we'll see how we go. But yeah, so that's it. I've had that appointment. He wants to see me in 2 months, so that'll be February. And I've also got to have a growth scan because of this tablet. But, you know, just double checking his growth is not a bad thing. It's inconvenient. I have to get there on the 3rd of January. My husband's just gone back to work and it's a bit of a pain in the bum, but it's one of those things, isn't it? Other than that, HG has taken a little bit of a dip this week. Thank God for that. Unfortunately, it's been replaced by a cold that my lovely husband decided to pass to me this week. So I've had 3 very sleepless nights because I haven't been able to breathe. It's all been like a head cold, so that's been very annoying. But on the plus side, it's Christmas next week. I'm really looking forward to seeing all my family. I may be able to eat some Christmas dinner if this HG just behaves itself and calms the F down and stays this way. That would be absolutely amazing. If I can eat a small amount of a roast dinner, I would be so pleased. So wish me luck with that. I may not get a chance to do another video now for a while until the new year, and God knows what will happen. I'm technically full term the Friday after Christmas, so he could come anytime. I'm just sitting here and waiting around. I did notice last night, which was quite exciting. Never been excited about period like cramps before, but I was getting a few cramps last night. I was like, you know that feeling you get when you're just about to start your period or you're just on the verge? And I thought, oh, that's interesting. I've not had that before. That's new. But that was quite exciting for me. I was like, ooh, things are progressing maybe in that department. It was very much, it wasn't painful. I was just very aware of it. It was uncomfortable, but it was fine. You don't forget that feeling when you're a woman. You know, menstrual cramps are horrible. So yeah, I thought, oh, that's new. But other than that, I'm uncomfortably pregnant. I'm struggling to put my socks on. My husband has to sometimes put my underwear on for me because I can't bend over. I'm getting this very strange sensation in my groin on occasions. It feels like I've got a dead leg in there. Like, I think there's a trapped nerve. I think one lady described it as lightning crotch, which I'd never heard of in my life. It's worse when I sit on the loo. It must be the position of my legs on the toilet, I don't know, and it just makes my leg go really weirdly dead, and it's quite painful. So that has been a new development this week. I don't know if any of you have ever experienced that before, but it is quite odd. And sometimes I'm walking around and all of a sudden I can feel it. It's like someone's giving me a dead leg right in the middle of like my hip joint and my groin area. It's a bit bizarre. But other than that, I'm feeling okay. I'm getting there. I'm just really hoping that this HG stays manageable now until the end of this pregnancy, because bloody hell, I'm sick to death of it. But I'm getting there now. I'm so close. You know, I'll be 36 weeks on Friday. I am so excited to get to that milestone. I'm going up to see my mum this week. Today, in fact, after work, Tim's taking me up. He's staying overnight and then he's come back for work the following day. And she's taking me to the hairdressers on Thursday. Oh, I can finally get this mop chop. Just look at the state of my roots. I've not had my hair cut for months. I think I was like 12 weeks pregnant and I nearly fainted in the hairdressers. It was a stupid thing to do. I'd made an appointment thinking, yeah, I can still attend to that, and I went really peculiar, nearly fainted because I was just so poorly. But I managed to get my hair done then, and I think, like I said, I think I was like 12 weeks pregnant or something, so that was the last time I had anything done to my hair, so I'm looking forward to that. So she's going to be with me, so if I do go a bit weird or I'm not having the best day, at least I've got some company, whereas last time I was by myself. And other than that, I hope all of you guys have a wonderful Christmas and New Year. I probably won't be doing a video now for a couple of weeks, but all being well, the next video I should be full term, ready to pop, or even better, he's already arrived. That would be nice. He can hang on for a couple of weeks, maybe just till after Christmas, because it's a bit of a busy time of year. But if he decides to come before Christmas, then that's fine, we'll just have to deal with it. But yeah, anyway, so thanks for listening. Just thought I'd give you a quick update on the heart side of things. But all's okay, and I will speak to you soon. Bye!